Hello, and welcome to another edition of To the Point, a show very generously produced by the American Acupuncture Council. I'm Virginia Doran of Luminous Beauty, and today my guest is a longtime colleague and friend, Tsao-Lin Moy. And she's been practicing for about 18 years in New York City. She founded the Integrative Healing Arts Center, and she has many accomplishments and has just been a publicity magnet. And also, she published a book called Will I Ever Get Pregnant? The Smart Woman's Guide to Getting Pregnant Naturally Over 40. So, because she has many areas of specialty, but because she has this on fertility, she's our guest today, and she's going to talk about integrating Eastern and Western medicine in fertility. So, without further ado, Cho, please, love to hear your approach, because I know you're very adept at combining the two, which I think is important for this
Great.
kind of
Well,
condition.
thank you so much, Virginia. And yes, thank you to the American Acupuncture Council for producing these Facebook Live shows. We'll start. So I'm going to talk about integrating Eastern and Western medicine, and in particular with fertility, but as practitioners of East Asian medicine, we all are now really integrating what we do with Western medicine. And so what I'm going to use is this presentation that is from Fertility Summit, and I'll be kind of adding a little bit and changing up as we go through the different slides. Okay. So it's really, more and more we're starting to look at patients that are looking for natural remedies and to be able to do both. And so one of these things is, looking at what is Eastern medicine's approach compared to Western medicine. And so these are how would Chinese medicine relate to improving fertility, but this also relates to how can it improve our health outcomes, and especially right now in the time of COVID, right? There's a lot of post-COVID viral fatigue, a lot of inflammation, and Chinese medicine, acupuncture is fantastic for that. A lot of questions that come up with fertility are age factors. And of course, we've been listening in the news that there are like 55-year-olds that are able to actually, bear children or carry, right? And really is looking at what is the best approach. And if I was speaking to a patient population, what's the best approach for them? And U.S. practitioners, looking at what is the best approach you can offer to your patients that you feel comfortable with and they feel comfortable with. And this would be with acupuncture and herbs. And if you also have other types of healing methods that you can also offer, of course, you would add those in accordingly. And so we remember that, Chinese medicine is really something that is personalized medicine. And that is what makes a big difference. Virginia already kind of went over a little bit of my bio. I know Virginia, we both graduated from Tri-State College of Acupuncture. So we're in this family tree of learning and also, helping more people to heal themselves. So I'm gonna just speak. We don't need to know more about me. Let me go move forward here. So really, when you're working with infertility, and especially women, really it's that patient and practitioner relationship. That we have empathy, for what they're going through, and that we can also help them to solve their problem. And that would be, they want to have a baby. They want to have a healthy baby, right? And so why is Eastern medicine? It's a better model and can serve women better that are experiencing infertility. This also applies to really overall health. So looking at how we as East Asian medicine practitioners really kind of fit into this big umbrella of a health model. Um, Now, with regard to infertility, statistics are 1 in 8 couples are experiencing infertility in the US. And this is not just the US, but also overseas. And we're looking at, as a global health problem, it's estimated 12 to 15% of all couples are experiencing, infertility, meaning they are not able to get pregnant on their own or within the time, it should, let's say, quote, should take. And really, we're looking at infertility is also more of it is coming from the male aspect. One of the side effects of COVID-19 is they're looking at it can cause sterility in men. And so a lot of the focus has been on, female infertility, egg quality, ovulation, hormone imbalances, and not a lot of attention until recently has there been attention more on the male aspect of it. And really, it's important that this is a collaboration, right? So 1 in 3 couples, the problem can't really be identified. It's considered kind of unexplained or infertility. And in that case, it could be a little bit of both, or there's some underlying issue that has not been addressed, which we address very well in Chinese medicine. So I wanted to just highlight a little bit that the Western medicine model is one we call like broken and fix. And so it's treating the symptoms, right? You like you're better if you don't have a cough. But the underlying aspect of it is like, why did you get the cough? You're run down. Maybe there's something else. And this is what applies with couples that are experiencing infertility, and also in general our overall health. Why aren't we recovering? And so a lot of it can be, the model in Western medicine is going to be vaccinate, antibiotics, antivirals, right? And that'll help to get rid of something, but there is damage in its wake. And then also, the recovery. So things like infertility treatments, when you go to a fertility clinic, it isn't without risk, right? Because the hormones have side effects, and also a lot of the procedures are pretty invasive, and they don't necessarily work, and they're also very expensive. But this is not to say you don't do that. You tell your patients don't go and see a fertility specialist. It's really like, how, if they're at that point, how can you help them on their journey, right? And so, coming from the aspect of Chinese medicine, East Asian medicine, is really, we're looking at, there's more than the physical that's there. I mean, as a Chinese medicine practitioner, we really practice, this is energy, right? We work with qi, we work with energy, and that is in our language, right? So there is also this aspect. What I wanted to also kind of highlight, in the Western model, they really separate out that spirituality, the mind-body connection, and one of the strengths of Chinese medicine is really where we're cultivating that connection. How do we help our patients? So this is another, just a slide that explains, infertility is on the rise, and there's also an infertility industry. It's actually a growing industry, right? Because there's a lot of money to be made. And here's a picture. This is what couples are looking for. This is the end, what they're looking for, right? So in this industry, there's going to be a lot of pressure for your patients to do hormones, et cetera, et cetera. And you probably are, if they've decided they're going to do that, it's not, you're not going to be able to change their mind. But what you would need to do is look at a collaboration with your patient, and also with the fertility or the assisted reproductive therapist. And really, What does the Chinese medicine is what's different than, let's say, a Western model is really that we are looking at that the healing is taking place in the individual. We're not curing them, we're facilitators, right? And I think it's really important that we remember this point is like we are treating the who, not the what, right? It's very easy, and I do see it in a lot of our profession to start to talk about treating the symptom and forgetting or not forgetting, but maybe not so much the focus on who that who is the person that is experiencing that. And this is something to remember as a practitioner, and especially with infertility, because a lot of statistics are going to show up over 35, hormone imbalances, and then what are your chances of getting pregnant. And while there are statistics that are useful, what's important is that your patient or the patients that are coming to see you, that is not them in the statistic. It may have relevance, but always to remember that this connection that you're going to help them with is physical, emotional, energetic, and spiritual. And this looking at this whole health perspective. And so, Virginia, if you have any questions or you want to interrupt me, please feel free.
I think
The,
you answered that because I was going to how you're kind of differentiating the whole health model from Western medicine, but you've answered it.
Oh, okay, all right. I just want to but the topic is really integrating. So even so, there it is possible that if you have patients that are using, let's say, Western remedies, that you can still come at the helping them from an Eastern model, from that whole health model, right? One of the things I'm going to move on with this about the rates, because we know that with the limited or very narrow research that has been done with acupuncture, it's very successful. And at the same time, the way that some of these studies have been designed are really kind of like, wow, can you cure for stage 4 cancer? Well, it's kind of like almost nothing is able to help, and then you're asking, like, oh, let's throw something this way and see if it really works, and then we'll write a study that says, oh yeah, this doesn't work for stage 4 cancer. Okay, so we always have to look at like the studies and their relevance, and not let I would say the scientific model define the kind of medicine that we do, and also influence us in a way that we start to look at, oh, this treats that, that treats that. We really want to remember, the person that we're treating. And so, as a reminder, Chinese medicine, East Asian medicine has the aspect is about balance. And these are the Taoist principles of dynamic balance, of yin and yang. So this is going back to, foundations of Chinese medicine 101. And I don't know about you, Virginia, what I found is that they're simple and they explain everything. And in very, the more that you're practicing, the more you're understanding that dynamic balance, right?
Yeah.
So in terms of let's say a strategy, when we're looking at what is within in the body, let's say a woman's body, or a man's, we're looking at what is the yin and yang that's out of balance. And so this could be like hormones, it could be sleep, it could be their relationship with their partner, where they're living, where they're working, and then of course how that manifests for them in terms of maybe they have irregular cycles, non-ovulatory cycles, fibroids, other let's say symptoms of, and those are, I would say, are symptoms of something being out of balance, right? So even if a woman gets surgery for fibroids, whatever was kind of causing it, the mechanism still needs to be addressed, right?
Mhm.
And so this is something that we do really well. Important is to that relationship with your patient is also educating them and empowering them to know more about their body, right? And this is again, we're facilitating, helping them to create a stronger mind body connection. It's also known as interoception, where you develop that sense of understanding what is happening inside your body. This is also important for us as practitioners, that we develop a practice, a mind body practice, so that we also can share that energy with our patients. Um, and in terms of, let's say, a treatment strategy, when we're looking at fertility, but also with whomever is going to come into your practice, we want to regulate what's the yin and yang, right? And the approach, I would say, no matter what, you're going to be looking at regulating the nervous system, right? Helping with sleep, digestion, and that in turn is going to help to balance their hormones. So different methods of treatment that we use, um, acupuncture for sure. If there are herbs that are appropriate and you have the training, that's something. Body work, we can use essential oils, meditation, exercise, and also, when we're speaking with our patients, we actually do a lot of mindset work, right? We're actually helping them to navigate through their difficult time and to reframe for them, or help them to reframe the challenge that they are experiencing. And one thing that we know, and also using food and herbs, and maybe changing their environment. One thing that we know with acupuncture in the research is that it does shift brain chemistry and affect neuropeptides in the brain that actually stimulate that self healing aspect, as well as immune response. And so this is great for what we do. Recent studies have shown that acupuncture is helpful in reducing the inflammation from the cytokine storms that a lot of people have experienced from COVID-19 and continue in a post viral syndrome. So, with women's health, according to Chinese medicine, and this is a review, it's really her menstrual health, the health of her uterus is a really good indication of the overall health of her body. Um, in a Western model, this is something known as the endocrine system, that regulates the functions of the entire body. So when we're looking at a woman's health, and in terms of, has she her fertility health, we really want to also look at her overall health, right? Because overall health, if you're overall healthy, then you're going to have healthy reproduction. And this is a good clue for all of us, that we have to kind of like look at overall health and constitution, no matter what someone is coming with, right? And I know, acupuncture is fantastic for treating pain conditions, right? Sprained ankles, uh, low back pain, sleep problems. But those are also symptoms of something bigger. What's happening in their nervous system? With an injury, why aren't they healing after a certain period of time? So someone who's really healthy, it doesn't mean they won't get injured. What will happen is that after a certain period of time, they should reach full recovery. Mostly what I see in my practice, and definitely I believe in the Western world, is that the amount of time for recovery is not given, or that people go back to activities much soon, too soon, and have not fully healed. And then what happens is that they end up having long-term, lingering problems that they can't quite figure out, right? So, one of the things again is that, with Chinese medicine, East Asian medicine, is that it's very personalized. We're not a one size fits all. We really need to look at the whole person. And as a reminder, a lot of times there are things that maybe we're not going to we won't catch if we become too micro focused. Let's
Right.
see. Do
You
you
know,
agree, Virginia?
I'm just wondering, just curiosity
Yeah.
about what percentage would you estimate women come for fertility from a deficiency-based cause versus like a, you know, obstruction of chi, for
Well, I
example?
mean, that's an interesting because you can have obstruction of chi from deficiency, right? I would say that there's much more deficiency, not necessarily blood deficiency, but exhaustion. So a lot of chi deficiency, a lot of stress. And again, looking at, constitutionally, here we're on the go. We need to do more. A lot of the women that come to see me, they are like, oh, maybe I should like start exercising, or let me start this, let me add something in versus, take something away. So having these very intense workouts, that it's not to that you don't want to exercise. It's really like exercising more is not helpful if you're tired and you're not getting enough rest. So I think, that's, um, yin tends towards deficiency, yang tends towards excess. Very famous words from our the founder, right? That it really becomes there's this imbalance that starts to happen, right? Women, they have. I would say that they, as they get age, they're definitely moving towards deficiency. There's the bleeding. Um, if they carry children, their jing, their essence is being used, their blood is being used, and this is compared to men. Women's bodies are the ones that undergo like a change every month, a transformation through the menstrual cycle. Does that make sense?
Oh, yeah.
Okay, so the health and healing using East Asian medicine is really, if we look at a whole health model, right? What's happening in their life? Women, especially for women, women very social. They're usually doing a lot more. They're searching to find out what's wrong. They're the caregivers. What we're seeing is so then to kind of answer your question even more, women tend towards getting much more depleted, definitely energetically and emotionally. And this is really being exemplified right now with the COVID-19 situation. Like so many women suddenly, even if they're working from home, they have taken on the additional burdens of taking care of the kids, managing the school, really, organizing. And I think there was one study that showed, when they asked the men, like, well, how many productive hours do you have? It was like, oh, I've got like 35, 40 hours a week productive. And for women, they were like 11, because they had so much more to take care of, right? And so this is something to also take into account when we're looking at overall health, in particular with women who are trying to get pregnant. Okay, so this is actually, I'm at the end of the slide, so I'm going to stop the sharing. Okay. Um, let me see what else there is. Herbal
So
medicine.
what, I mean,
Yeah.
obviously there's a need for this, but what inspired you to write your book?
Well, Virginia, so many women that come to me were just suffering. They had a lot of failure from trying to get pregnant. They had oftentimes were not the first, the first stop. They go through several cycles of IUI or IVF. They've, tried many different things. I've noticed that a lot of my patients, when they come to see me, they've already done a few cycles, and they're really at this, point of frustration and struggle. And so, I looked at the statistics. It's actually very interesting where they came from. I had to track it down because everywhere it was like the same statistic, almost verbatim. And then I found a journalist who had done the research. And apparently, those numbers come from churches in France from like 1680 to 1830, where they looked at baptism records and the maternal age, right? So we're looking at, 17th century birth records, and then they did an analysis, and they were like, oh, only a certain percentage of the women were over a particular age. And so they use that as a guidance, and it is a statistic. It's an accurate statistic for that aspect. So this is where we start to get into a lot of the studies and the research. And but what isn't taken into consideration is, did they have children before? How about other illnesses? There wasn't any hygiene, right? There were a lot of women that were dying in childbirth, or there were a lot of infections. There was child mortality. The living conditions were horrific, right? So kind of using that model, or using that and then applying it to right now, where we have, good nutrition, we have education, we have housing, we have a lot of things that the women and the families didn't have then. And so and also nutrition wise, right? So this is something that, looking at, where is the information coming from? How accurate is it? How does that really apply to your circumstances? Right? So I say, yes, there's truth in those numbers, but is it your truth? Right? So that's a whole other discussion. And then, because we do very, personalized medicine, that, we, the chances of getting pregnant, the odds, it's much higher, right? And especially even if, a woman decides that she's going to do IVF or IUI, as soon as they add in the acupuncture, increases like tremendously the success rate.
Yeah. So what are the general statistics for acupuncture helping for infertility?
Well,
Numbers?
that's actually a very tricky question. The one statistic that we had that was really done is a pretty old. I think it was from 2003, and it was the German study that had done just very limited, like a certain protocol of numbers, and they had increased the success rate by like 42%. It was a very high percentage. And the women were all like, it was really like women that got acupuncture versus women that did not get acupuncture. And really to bring those numbers to, let's say, 42%, that's huge, right? Uh, so aside from, have there been other studies done recently? That I don't know. Statistically, we also look at, and this is what I tell my patients, when you go to a fertility clinic, the fertility clinic is really seeing people who are struggling. And so there are those numbers. There are many women, many couples that have children later, but since they don't have a problem, they're not going to show up as in the statistics, right? So it's like, oh, when someone works in the emergency room, they see the worst things that happen. But there's like a whole other population that don't get sick or don't have heart disease or don't have those things. And so when we start to look at data, we have to really look at much more individually what is going on for that person. I mean, we do all have commonality, the biology, et cetera, et cetera. But our destiny, our health destiny, is really something that we can make a difference and make changes for the better. It's not set in stone, right?
Right. And of course, the results are only increased when it's combined with herbs and lifestyle and whatever that patient needs. So,
Absolutely. I mean, this is really a collaboration. And again, like to kind of reiterate, this integration of East and West. It's not an either or. It actually works much better when, wherever your patient is on their journey, they don't necessarily all need hormones, but if they do, they're there, right? And we want to look at, how can we support that person for the best outcome, right? And no matter what I look at it is that with the Chinese medicine model, East Asian medicine model, is that we are supporting that whole person and helping them. In the end, the result is that they can have a family, right? And so we have to look at like, how do we work really together for the best outcome, right? And yeah, herbs, I mean, if I have a patient that is going through fertility treatments, of course I always say, check with your doctor, are they okay with you taking herbs? Like, we really need to have that dialogue open, not like it's a separate thing. And also, I want to know if somebody is taking different medications, so that we need to really be able to do what's best. I would not recommend herbs for somebody if they're already doing something pharmaceutically. Uh, what we could have a discussion about is really, maybe there's a way to, lessen them, or, talk with your doctor about, alternatives, or can we try something? Always the patient safety, right? And the trust, right? So that's what I would, that's how we're going to work so much better and help a lot more people.
yeah. So, well, I'm so glad you were able to come today on such short notice. And
Thank you.
I know the timing was crazy, but it worked out. And of course, you're always, give 100% to everything you do. So, it's just great to have you. Is there anything else you'd like to say before we wrap up?
Well, what I would say is that right now is really the time for us as Chinese medicine practitioners, acupuncturists, alternative medicine, to really step up and be heard. Important to educate the public about what it is that we do. There is a lot more information that is coming out about acupuncture, herbs, for health. And I know a lot of times practitioners tend to, not want to post or write articles or, get out there. But it's important that that we as practitioners are visible, right? And that the public knows that we can help them. And we have a lot of other solutions, including, pain instead of being on opioids. This is a huge issue, that we are expert at helping people with pain. We are expert at helping people recover from surgery, from nausea, helping immune system. And more recently, definitely for, reducing inflammation, from this, the inflammations from COVID-19, right? And so when everyone's looking for the magic bullet of a vaccine, of a antibiotic, of immunity, that we as practitioners can actually really help people have healthier lives, right? All of the comorbidities that are out there, we're looking at a whole health model, and this is something that is going to make a big difference in terms of the quality of life for the public, and especially in America, we need a lot of help here. And But the important thing is that that as practitioners, that we're able to be found. And a lot of times practitioners, they just kind of like hide, they hide. So that's what I'd like to say to all my colleagues out there. Get visible.
Well, you haven't been hidden, that's for sure. Well, thank you again. And thank you for the American Acupuncture Council for producing this. And I'm Virginia Doran, luminousbeauty.com. You can reach me there, and on Facebook and Instagram. And we'll see you next time. Okay. Thanks for
Great.
tuning in. Bye.
Thanks.